Thank you so much, Johanna, for an amazing talk, as ever. So we'll proceed with the opening ceremony.
Good morning, everyone. As we begin our day today and our conference, let's start by reciting some sacred words from the Holy Quran.
اقرأ باسم ربك الذي خلق خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم كلا إن الإنسان ليطغى أن رآه استغنى إن إلى ربك الرجعى أرأيت الذي ينهى عبدا إذا صلى أرأيت إن كان على الهدى أو أمر بالتقوى أرأيت إن كذب وتولى ألم يعلم بأن الله يرى.
صدق الله العظيم. Now, it's my honor and pleasure to invite you all to rise as we play the national anthem of the United Arab Emirates. Thank you. Please be seated. Your Excellencies, Dr. Ahmed Al Khazraji, Director General, ADPHC, Your Excellency, Dr. Al Hajri, Executive Director of the Community Health Sector, esteemed guests, distinguished speakers, valued participants, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. It's with profound honor to welcome you to the 6th UAE Obesity Symposium and the first World Obesity Federation MENA Chapter Conference in the magnificent city of Abu Dhabi in our beloved United Arab Emirates. We gather today as a community of healthcare providers advocating, sharing the same commitment, tackling one of the most significant healthcare problems facing the mankind of the 21st century, obesity. The theme of this year is obesity is a multi-organ disease. It shines a light on the intricate and far-reaching impact obesity obesity is not about weight. Obesity affects every single organ and system in the human body. The complex nature of obesity reminds us why a collaborative, multidisciplinary, transdisciplinary approach is needed to tackle this problem. It reflects our commitment to bring together brilliant minds like all of you with diverse perspectives to spark insight and share groundbreaking research and foster solutions that will help us to fight this global health problem. Under the visionary leadership of His Highness Sheikh Mohammed bin Zayed Al Nahyan, the President of the United Arab Emirates, and His Highness Sheikh Khalid bin Mohammed, the Crown Prince of Abu Dhabi, the UAE has taken bold strides to promote healthier lifestyle and raise awareness about the risk of obesity. And hopefully, we will be, with this leadership, will be able to be the first country in the world to control it in the future. Their commitment serves as a beacon for inspiration for all of us. The hosting of the conference in Abu Dhabi makes perfect sense, and it's truly fitting. To our honored guest from the World Obesity Federation, although you are not guests, you are partners, we extend a heartfelt welcome to Abu Dhabi, a city that's well known to you, and to the United Arab Emirates. Professor Donna Ryan, thank you very much for all your kind support. The conference is a unique opportunity for all of us to engage in a meaningful discussion and exchange our experiences in fighting this problem. As we embark on the sessions ahead, I encourage each and every one of you to share their experiences and to be part of the meaningful conversations and discussion to find a solution. We may leave this conference enriched with knowledge, inspired by new perspectives, and a shared commitment to improve the life of people living with obesity. Welcome to Abu Dhabi. Welcome to UAE. Enjoy the weather. And thank you very much for being here. I invite my colleague, a partner, Dr. Sarah Suleiman, to introduce His Excellency, Dr. Ahmed Al Khazraji.
Thank you very much. It's an honor and a privilege to introduce Dr. Ahmed Al Khazraji. I will go through his resume, which is stunning, but first of all, I would like to thank him personally for the vision and the leadership that he's giving obesity in the UAE, and in Abu Dhabi in particular. He's only been executive director of Abu Dhabi Public Health Center for a short while. However, his prints are already there. He's led serious changes, including leading Malafi and incorporating staging systems into understanding that obesity is a disease rather than working on BMI alone. He leads this strategic direction, and we are grateful for your support. As I said, he's the Director General of Abu Dhabi Public Health Center. He aims to achieve the center's vision of moving towards a healthy and safe society by leading initiatives and programs of preventing disease, prolonging life, and promoting a culture of healthy lifestyle amongst community members. His immediate past role was Executive Director for Strategy and Policy at the Department of Health, Abu Dhabi, where he was responsible for leading all the activities under strategic planning, performance management, and institutional excellence. And yet again, he made a huge difference there, including the introduction of digital health. Prior to DOH, he was the Director of Health Affairs at Abu Dhabi Executive Office, responsible for driving Abu Dhabi's health agenda through initiatives, programs, and special projects. He's a doctoral trained clinician and has over 15 years of healthcare experience across public and private sectors and has held multiple clinical leadership roles. Thank you very much for your leadership, and we very much look forward to your talk.
This one or this one? I don't know. Bunch of microphones here. The handheld one? Okay. Good morning, everyone. It's really nice to see a packed room. I speak at quite a few events, but this is one I was telling the team. I'm actually really excited to be here. This is a topic that's very important for me personally, for my team, and also it's the biggest really biggest public health challenge I think that we're facing today. And it's going to take a lot of very collective, focused effort to tackle this really daunting challenge. When we talk about obesity, it's often framed as a global health challenge, a crisis that affects millions around the world. But today, I want us to look inward. While I said it's a daunting issue globally, it poses a particularly alarming prospect right here in Abu Dhabi and across the UAE. I'll give you guys some numbers that will put this into perspective. And this isn't, these aren't numbers extrapolated from some global report that was published. These are real Abu Dhabi numbers coming from Malafi. And for those of you who don't know, Malafi is our health information exchange that's connected to 100% of healthcare facilities across the Emirate of Abu Dhabi and represents the entire Abu Dhabi population. So these are real Abu Dhabi numbers. 61% of adults in Abu Dhabi are either overweight or obese. 22% of those are confirmed obese. When we look at children, 37% of them are either overweight or obese, and 18% are confirmed obese. When we look at how much we're spending on treating obesity, in 2023 alone, we reached almost 2 billion dirhams, and this is just in direct medical costs. When we look at direct and indirect, that number literally 10x's to 20 billion dirhams. And by indirect costs, we're looking at absenteeism, we're looking at lost productivity, premature death, et cetera, et cetera. And it's estimated across the UAE that that number balloons to almost 40 billion dirhams. This is in 1 year alone. Abu Dhabi also, we have some of the highest healthcare spend per capita globally. But the problem is our population is younger compared to other countries. And bluntly speaking, if we continue on the trajectory that we're going, the economic impact is on track to reach almost 5% of our annual GDP. Now, if that doesn't scare you, I mean, it scares me and should scare all of us. If this isn't a call to action, then really I don't know what is. But I do see hope. There is a silver lining. In today's world, the smallest actions of one individual can ripple out and inspire countless others. It's in this shared human experience that I want to reflect on an aspiration that is both humbling and powerful. And that's the aspiration to be a role model. At its core, this is not just about leading by example, but about recognizing the quiet strength that each of us carry to ignite change in those around us, to be the spark that lights the way for others to follow. This is our ambition in Abu Dhabi. We aspire to be a role model, a case study, an example setter for other countries around the world looking to curb the obesity pandemic. We want to be the first global case study for reversing the obesity epidemic here in Abu Dhabi. That's our aspiration, very simple. That means promoting healthier lifestyles, encouraging physical activity, creating environments that make it easier for people to make nutritious choices, and increasing access to activity spaces. As the regulators, orchestrators, community guardians, and enablers, this is a challenge that starts with all of us in the room here today. Now, I'm newish to the role, about 7-8 months now in the role. But I'm really confident in Abu Dhabi's ability to achieve this aspiration. We have all the ingredients here to do it. And I want to share with you guys a few concrete tools and initiatives that we've already launched or are soon to launch to help put in perspective how we're looking at tackling obesity here in Abu Dhabi. First, our talk about our tools. You were seeing on the presentation earlier, data. We have a lot of it, and we've had a lot of it for a while, but we needed to clean it up and have it focused on our big disease burdens. I'm focused on 6 disease burdens, 6 major ones. Guess what was the first one that I put my efforts into, as some of the people in the front here know? We have an obesity disease registry. We launched it this month, and we finally have a trusted, comprehensive, real-time source of truth for obesity data in Abu Dhabi. When I was at the executive office and I was engaging a lot with the Department of Health and Abu Dhabi Public Health Center, one of the challenges that we would have is there was no source of truth for our big disease burdens. We would get numbers from different sources, or maybe a report said this and Abu Dhabi's number or UAE's number is extrapolated to be that. We needed Abu Dhabi specific numbers, and we have that, and we've launched it today. This obesity disease registry amalgamates our extensive Malafi data, and Malafi has billions of data points. Just need to clean it up and make sure that it's presented on each specific disease burden, as I mentioned. And it gives us actionable insights that we can act on immediately instead of just trying something that's widespread and hoping that it works. And this registry, it gives us comprehensive patient demographics, broken down by gender, by age, by nationality, all the demographics you would want. Prevalence rates of the disease, and as Dr. Sara mentioned, we're clinically staging patients using the Edmonton Obesity Staging Scale. So not just we have 100 obese patients, no, we're breaking it down by their demographics, by how prevalent it is across the different regions within Abu Dhabi, but then also clinical staging. So we know these are the number of patients, and this is the most effective evidence-based intervention for this cohort of patients. And for that cohort of patients, surgery, weight loss drugs, whatever it is. We also have incidence rates and what we call at-risk groups. How many new cases of diabetes are we seeing, and how many are at risk of becoming new obese patients? And these are the people that we're going to be targeting first and immediately and most urgently to prevent them from becoming obese. And then also, all of these interventions that we're doing, how cost effective are they? What are the clinical outcomes that we're seeing? We can see that as well. We also have Sahatna. So some of you may or may not have heard of Sahatna. Sahatna was recently launched at GTEx, the GTEx Global. And essentially, it's a super app that is the virtual front door for the healthcare system in Abu Dhabi. And it has many features that make it a really exciting tool in our fight against obesity and other diseases, and then also ensuring that there's quality healthcare delivery for those patients who are sick. So it integrates with all, when we look at how does it apply to public health and obesity specifically, it integrates with all major wearable devices, gathering essential lifestyle data such as physical activity, your number of hours of sleep, and other vitals, and you can see that in real time. Users can also monitor their health more accurately, making it easier to track progress and stay motivated as they work towards their health and wellness goals. It's all about that incremental progress, as we know. Just keep building on the progress that you made yesterday, and then tomorrow what you made today. And yes, of course, we have included a whole bunch of AI into it to make personalized recommendations for each user based on the data that it's gathering. So again, it's not one recommendation applied to everyone. It's actually tailored to the specific individual. It also has nudges, gamification, a reward system, and all these other things as well to help people, again, stay encouraged and motivated to keep on their journey. Beyond these two, and we have many other tools, but these are the two really big ones that I want to highlight today. And in addition to those, we've defined 20 initiatives that make up our Tackling Obesity program. And these 20 initiatives were not just taken from thin air or looking at, what are other countries doing and copy and paste. This was a result of a 3-day government retreat where they brought all the senior leaders across the Emirate of Abu Dhabi from the highest levels. And we went to tackle the 3 most important topics, or the most important challenges across the Emirate of Abu Dhabi. One was health, one was education, and one was on technology. And guess what the health topic was? But the powerful statement in that is one, in that obesity is not just a health problem. It's an Abu Dhabi problem. It's a UAE problem. It's a global problem. And this is the message that I'm very happy to see is really resonating with leaders across different sectors within the government. The municipalities and transport know they need to help with enabling physical activity. The Food Control Authority need to help us with. So it's now become an Abu Dhabi issue. Now these 20 initiatives are across 3 key settings: workplaces, educational institutions, and the community, and are using 3 key levers: physical activity, how food is produced and sold, and then how food is consumed. And like I said, we're collaborating very closely with other government entities to make sure that we do this holistically and with maximum impact. I want to highlight just 3 of these initiatives to show you guys, again, how serious we are about tackling obesity here, and you guys should get excited with what you're going to hear. So first, front of package labeling. We're finally doing it. So on November the 26th at the Abu Dhabi International Food Exhibition, we're going to be launching, and by launching I mean mandating, the Nutri-Grade front of package label across food and beverage products in the Emirate of Abu Dhabi. It'll be divided in 2 phases. Phase 1 will focus on 5 key categories. That's breads and pastries, sweetened beverages, cooking oils, dairy products, and what we term as children's food. And we have a list of what that means. And then the second phase is going to expand on these 5 categories of food and beverage and also introduce a system certification for non-packaged food. We know that people struggle to understand what's in the packaged foods that they eat and how that impacts their health. The Nutri-Grade front of package label will make it easy for them to understand what they're buying and what they're eating. How healthy or unhealthy is that? The choice is theirs, but we need to give them informed choices so that they can make them. And I don't think anyone intentionally eats to harm themselves. So we're very excited about that coming next week, which is great. The second is our weight loss drugs policy. I don't need to speak about how weight loss drugs have become, a phenomenon around the world and here, but we need to have a policy that governs this in the right way. We've been working hard and fast on this, consulting with and incorporating feedback from experts, including many in this room, and global experts to make sure it is robust and evidence-based and as comprehensive as possible. Also, leveraging our obesity registry that I spoke about earlier. We know the eligible populations we want to target. We have a good idea of our estimated costs. And using Sahatna, we can track and incentivize patients to integrate and adopt healthier lifestyles. And we will launch this before the end of the year. And then lastly, a new, what we term a healthy living movement. I can't get too much into this right now because it's still in the planning stages, but we're launching a bold new movement, not just a campaign, that's going to ignite a collective shift towards healthier living. It's really a call to action for people to live healthy all the time. And it's going to be based on 4 key pillars: physical activity, nutrition, sleep, and mental well-being. Now, as I'm sharing these tools, I hope you guys are realizing the clear themes that are standing out and that we are focusing on as we're designing these initiatives. And that's empowerment, and prevention. We say that because we know when people engage with, too often today, whether it's here or around the world, when people engage with the health sector, they do it when it's too late, when they're already sick, when they already have advanced levels of disease. And we want to prevent that and prevent the onset of illness before it happens. And that's why empowerment and prevention is the core focus of what we're doing. And as Dr. Haddad said, we have the opportunity and we're aspiring to and we're making all of the steps towards being that global reference case, that case setter, that case example, that trend setter, if you will. And we want other places in the world to look at Abu Dhabi and see they did it, how did they do it, let's learn from them and implement. So I leave you guys with one request, which is I encourage each of you to embrace the aspiration of being a role model. Look at your community, not just through the lens of your local goals and challenges in tackling obesity, but through the eyes of those who might be watching and learning and implementing change because of us. Thank you all very much. I hope you enjoyed the rest of this wonderful and enlightening conference. Thank you again to the World Obesity Federation for being very strong partners with us. You know that we're strong partners with all of you. And I hope you all enjoy the rest of the conference today and tomorrow. Assalamu alaikum wa rahmatullah.
Thank you very much for an awesome speech. Thank you very much for all that you are doing for obesity. We're very grateful to have your leadership, and thank you for honoring us with your patronage today. We have a small gift from the UAE Obesity Conference and the first MENA Obesity Conference. Thank you.
Sir.